Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. I'm here with Mike. What's up, Mike?
Hey, how you doing?
We're going to talk today a little bit. Mike has been doing hormones with us for a little bit. He went to his primary care, I think, before us, and wanted to kind of explain the difference and some of the benefits. So we're going to cut the break, and we'll be right back.
All right. Ready?
Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. I'm here with Mike. What's going on, Mike?
Hey, happy.
Actually, we've been talking about dogs more than hormones. We both have American Bullies.
Yeah, great dogs.
Yeah, they're awesome dogs. Which kind of, if you don't know what they are, they're kind of like a muscular pit bull, I'd say,
Yeah,
but
yeah,
real friendly,
absolutely.
like not aggressive whatsoever.
Super great dogs.
Yeah, so we've been doing some dog talk here. So if you're looking for a dog, American Bully's a good one, right?
Absolutely.
But anyways, Mike's been a patient at Buckeye. When did you start as a patient? I don't even.
A couple years now.
Okay, awesome. And then you had done hormones before coming to Buckeye. You had
Correct.
done like some of the androgel, or
correct. Right.
Like when did you first? What are the symptoms you had? Why did you even look for androgel?
As I got older, I noticed that my energy level, the sharpness, willingness, been married and so forth, it just everything. I started feeling old. Basically, I got to the
And what
point-
age were you when you started really noticing it?
Early 50s.
Okay.
50ish.
Okay.
Right around through there. I probably could have, I probably should have been tested way before then because the symptoms were there. I just didn't have the idea and didn't know much about it.
Yeah, and the kind of the crazy thing I always tell people is, until androgel came out, if you really think about it, when did androgel come out? Maybe 7 years ago now. I don't even know.
Yeah.
But before that, no one got their hormones tested. So what happened, because there was no money in it, but what happened is androgel got a patent for that medication, and then all of a sudden it was kind of like what there was no Viagra 20 years ago.
Correct.
But they got the patent for it, and all of a sudden they're advertising for it, and it made Viagra cool and made androgel cool, right? If you think
Correct.
about it.
Yeah.
Because I can even remember, we'll say 10 years ago, if you said you were going to be on hormones, people would say, oh, you're on steroids, or it wasn't cool.
Yeah.
But then the androgel ads came out and said, you shouldn't have to feel tired or feel like you're getting older, and that's when it kind of came mainstream.
Correct.
I think,
Correct.
so we can thank
Yeah.
them for that. But what a lot of people don't realize is, androgel. There's lots of side effects to it, which we talked about on the shows. The first side effect is, number one, if you're really low testosterone, it's really weak. I mean, what was your experience with androgel?
Absolutely no benefit from it. I didn't feel anything from the start. I was probably on it for 8 months, and it's one of those if you can't tell the difference, why bother?
Right. Yeah, and I tell people the same thing when you come to Buckeye. Hormone replacement therapy, if you need it, and number one, the blood work never lies. So when people call me, I had a call today. A friend of mine called up. He's getting ready to go to Greece. He's an old patient. He hasn't been a patient for a long time, but he heard one of the radio shows like, "Hey man, can I come in? I'm going to Greece," and he's 44, and he's like, "I just don't feel like I can get in shape at this point in my life." I was like, "You come and get blood work done. We'll see what's going on. If your hormones are messed up, we'll fix it." But I always tell people, hormone replacement therapy, like we all know we should take vitamins. Vitamin C and CoQ10, and there's a bunch of vitamins. But when you take vitamins, even though they're good for you, you don't really notice it, right? I mean, but you should still. I'm not saying don't take vitamins; it's important, but
Correct.
but you should take them, but you don't notice it. Hormones, if you're deficient and you take it, is a game changer. It's night and day. It's not like you won't wonder, does this work? Does it not work? Like it's a game changer. I can speak for myself. I was in my late 30s, and before we even got into the hormone thing, and I've always worked out my whole life. But I found I was in my late 30s, and I would get different injuries and just didn't have the motivation. And it was the first time in my life I was like, man, this I really can't work out. I don't feel like it. I work all day long, and I just don't have the energy for it. And that happens to a lot of people.
It does.
And that's when I kind of discovered this whole hormone thing, and I got my blood work done, and my levels are low, probably because of high level of stress. I'm a pretty high stress guy, and when I got on hormones, like man, for me it was amazing. I went from having no energy to tons of energy. Obviously at that time we had physical therapy, chiropractic, massage in at Buckeye, and I was getting treated all the time, and it would help, but it wouldn't last. The same injuries kept coming back over and over again. And it came to the point I was almost, thinking about quit working out and maybe take up riding bikes or jogging or something like that. 'Cause I wasn't even having fun working out. I wasn't getting pumped to the gym. It was not enjoyable anymore. And then when I got on hormones and simply supplemented what my body didn't produce, I mean, I felt Like literally, I'm 48. I'm in the best shape of my life, and there's no reason everyone can't be that way.
Yeah, and I talk to friends, and a lot of people are, their first thing is about the libido, and I try to explain it's so much more than that. It's my
sex sells everything.
Absolutely.
Sells, so, yeah.
I mean, that's that's your Viagra's and Cialis and all that fun stuff. But the energy level, the way I feel, there's multiple benefits that I've gained from this. Besides the libido, is like the icing on the cake. So, for those who haven't tried it, I've talked to a bunch of friends, and it seems to be everybody feels the same. So
yeah, I mean, if you need it, it's night and day. And I think the only thing I ever hear back is people are mad they didn't start sooner. You have people that come in their 50s and like, man, I the last 10 years I felt like garbage. If I had known this 10 years ago, I wouldn't have had to suffer through this. So
right.
So that's the I was on TV earlier today, and Robin asked me, she was, what do you like most about it? And what I like most about the way we do hormones at Buckeye is people love it. Like I have patients call me. If you looked at my cell phone, people call me all the time. Hey, thanks, doc. I feel great. People are sending me, guys like workout pictures and stuff, which I'm not, into, but
it's working.
But it's cool. Like,
it's working.
I mean, it's one of the few things we do that that and stem cells are things that people get immediate results. And as a practitioner, we always want to help people out. And when people, they're calling you and texting you, telling you how amazing they feel, man, it's the best ever. And some people it's even save their marriages because a lot of times when people get older. A marriage you got to work on, and if you don't have the energy to put into your marriage, or no sex drive, and then that can cause problems in a marriage. Getting that stuff back, man, it's what it's all about.
Right. It's like being a teenager again.
Yeah, heck yeah. And there's no reason, and we talk about, what we do at Buckeye is bioidentical hormone supplementation, and basically what that is if you're deficient in testosterone or estrogen or progesterone or growth hormone, we simply give you exactly what your body used to produce. So that's not a synthetic, but a bioidentical. And there's a huge difference because synthetic medications like Premarin, Provera, these medications are drugs that mimic hormones, but they're not the hormones themselves. And that's why there's all these side effects, cancer, heart disease, all these different things. But we don't use that stuff. People always ask me, well, why would my doctor give me, like we'll take females for instance. So every female that goes through menopause should be on hormones, every single one. And one of the first symptoms of menopause is you're going to have hot flashes, which is simply your body telling you, it's a lack of estrogen. So what typically happens is someone will go to their doctor and they'll say, hey, listen, I'm having hot flashes, and their OBGYN or their primary care will say, well, listen, we'll put you on some estrogen, and they'll put them on Premarin. Well, Premarin's not estrogen. And Premarin is known to cause cancer. It's not even debatable. So why would my doctor do that? Well, your doctor doesn't mean anything bad for you, but what a lot of people don't realize is physicians, once we graduate school, the only education we get on drugs are from drugs companies. So unless someone's willing to go out there and do their own research, like myself and Dr. Baden did, we both got our diplomates in anti-aging. Your education is going to be based on a drug company's going to come in, they're going to buy you lunch, they're going to take you out to a nice dinner, they're going to take you to a country club, and they're going to talk about their drugs and how good they are for you and everything. And that's the education they get. So, and unfortunately, it's even worse now because all the hospitals are buying up the primary care physicians. So basically now the drug companies are educating the hospitals. And if you really look at even the medical schools are funded by drug companies. So if you want to see, and that's why healthcare is so messed up in our country, because, half the drugs we take cause more side effects than the benefits of them. And when these natural things are out there, bioidentical hormones, there are no side effects. It's impossible to have a side effect. Now, obviously, you can over or underdose your hormones. That's why we do blood work. I mean, you're getting blood work every 20 weeks.
Correct.
And we keep a close eye on it. And that's something that a normal primary care or a hospital wouldn't be able to do. So there is a higher level of monitoring your case. But if you're taking it properly and monitoring yourself, you'd really be crazy not to do it if you need it.
Right. I've had zero bad side effects.
Yeah, and it's impossible to as long as you're monitored properly. So you did the androgel for a little bit, and you said really. So what? You just went to your doctor and said I'm just kind of lacking energy, whatever.
At that point in time, the supplements or what we're doing now, as far as your treatments, it wasn't even offered. It wasn't. Well, maybe you need to go to talk to someone else. It's here you go. Let's try this, and
which was the androgel or whatever it was, and then where'd you put that on?
Shoulder.
Yeah, and it stinks, doesn't it?
It does, and then you get, like we joked earlier, you have to watch, as far as getting around your wife or children or anything, because it does have bad side effects. So
yeah, and what you're talking about is cross contamination. So with androgel, And we've actually had a couple patients that, one patient in particular, they had a really young daughter, and the daughter was starting to have some just weird issues. And I want to say she was like 2 years old at the time, but like was growing hair, doing all this stuff. So they took her to an endocrinologist, and they couldn't figure out what was wrong. And they finally put it together. Is he was on androgel. This is before we even offered it at Buckeye, and he would hold his daughter like any loving father would at nighttime, and on his chest, that's where he put the androgel. So she was getting cross-contaminated with the androgel because it sits in the skin. And the daughter was getting high levels of testosterone. So that's why, androgel for guys just doesn't make a lot of sense. And the other reasons we don't like gel for guys is there's two really big side effects that happen with androgel, or Testin. There's a bunch of different ones. There's Axeron, all the testosterone gels for men. The first thing that happens is when you put testosterone gel on your skin, in particular when it touches hair follicles, the testosterone converts to this thing called DHT, which is dihydrotestosterone. Now, DHT or dihydrotestosterone has two nasty side effects for guys. Side effect number one is if you have DHT sensitive hair, which a lot of guys do, it will accelerate your baldness. Okay, your hair's pretty good. You don't have DHT.
Yeah, luckily, yeah.
Lucky sucker. Anyways, but if you have hair that's likely to fall out, it's going to speed up that process by tenfold. The other problem, and the more important thing that this DHT does that's caused from putting on testosterone gel in males is this DHT also attaches to your prostate. And over 90% of males over age 70 have prostate issues. And this DHT accelerates cellular growth and you're basically prostate enlargement. So if most guys already have prostate issues, why would you want to add fuel to the fire? And that's what testosterone gel does for men. So at Buckeye, we won't even prescribe testosterone gel for guys. And the third thing, it's really weak. So I think you had mentioned your testosterone level was like in the 200s or something, which is low.
Yeah, it's equivalent to an 80-year-old man.
Yeah, and so you would literally have to take a bath in testosterone gel for it to work. So it just doesn't even make sense, So that's why we don't offer it. Now, as a side note to that, testosterone gel for females works great. And the reason for that is, number one, females don't have DHT-sensitive hair. And number two, they don't have prostates. So testosterone gel for females and DHT increases libido. That's that sex thing we were talking about, sex cells, right? Mm-hmm. But so for females, we like testosterone gel because it increases libido and it doesn't affect their hair and they don't have prostates. And females, obviously, their levels are about 1/10 of a male's. So even though it's weaker, it's fine because females need 1/10 of what a male needs. So that's kind of where the specialty and where, Buckeye, our training has allowed us to pick what's best for each patient. And there's no cookie cutter to this too. There's some females come in that we do gel on and we decide they would do better with pellets or injectable. Like there's no cookie cutter program. Everyone's different. That's why we do the blood work and stay on top of the stuff. So you were doing the testosterone gel and you didn't notice a difference. So no. You went back to your doctor and
I basically at that point in time I had, I informed the doctor of that and there wasn't really an alternative. So I went to the local, vitamin store and went to, over-the-counter tablets and things like that. I actually gained probably a little bit more from that, but it was temporary. Mm-hmm. And, it gave me a sample of what I could be like, which mm-hmm. just made me, want a little bit more at that point in time. Because
how many years ago was that?
It would have been probably 4 or 5 years ago.
Okay. Well, you remember what the product was, like an androstenedione or something like that?
I do not.
Because there was some products that they're illegal now, but there was some products about 4 or 5 years ago, like androstenedione. That's like Barry Bonds and those guys were taking.
Right.
They were steroids. The only issue with those things is whenever you take any type of oral steroid, it has to be methylated, which basically that methylation process means it double passes the liver. So although they worked, any oral steroid is going to be really liver toxic. And if your liver's all crumbed up, you don't feel good anyways. So.
Right.
So that's why we don't prescribe any oral steroids. It just it just doesn't make a whole lot of sense.
It's just as expensive. I mean, if you take the recommended dosage on most of that stuff, I mean, it's you add it up. I mean, it's probably even more expensive than getting the professional treatment.
Yeah, and the stuff. What's happened now though is the stuff available at like the different nutrition stores like GNC and stuff. There's one that who's the old baseball player guy, Frank Thomas. And then I think Bo Jackson's doing one now too, or something. Like we've had several patients that come in there taking that stuff, and do you notice any difference? No. Well, let's do your blood work and see if it even works. And it doesn't do anything. It's a bust. It doesn't work. So, if you're listening to the radio and you're taking what is the Frank Thomas stuff? I don't even remember what it's called. Nugenics maybe or Nugenics, and I don't know what Bo Jackson got his, but whatever. It doesn't work, and the stuff's expensive too.
Oh, it is.
So you're basically you're peeing it down the toilet. So don't waste your time because doing it properly isn't that expensive.
Correct.
And that's with your blood work and doing everything and getting monitored closely. So well, we're going to cut the break real quick, and we'll be right back. What's the one, Bo Jackson?
It's called Eugenics. But it's
Bo Jackson doing that one too?
Yep, they're both doing it.
Yeah, where the girls are standing there. Hey, there's Frank Thomas, the big hurt.
Oh,
Talk about
yeah.
the big hunk.
Yeah,
I watch
I
a lot
remember
of
that.
television,
Yeah, I
so
remember
I
that
see that.
commercial.
Like on ESPN, they air that on ESPN.
He's still
like 1,000 times a
He's still
day.
big, but I mean, he's kind of doughy big, not like when he was playing for the White Sox.
No, not like he was ripped back then, and he was playing at Auburn and playing for
Yeah, he
Frank
played
Thomas
tight end.
and Bo Jackson. Yeah, both played at Auburn. Those places, they're hitting up ex-Auburn athletes. Maybe they'll get Charles Barkley next.
I think that's part of.
They'll hit up Chuck Barkley and say-
he has a
Yeah.
supplement company. I think it's his.
And Chuck will go, terrible, terrible, terrible,
This big boss is
terrible. This is terrible.
The tea market is so popular. I mean, everybody
yeah.
wants a piece of it. The problem is 98% of the stuff out there is garbage. I mean,
You can't. There's nothing you can buy over the counter that works. Nothing.
No. Like I said, I even tried the gel, obviously, and then did the pills after the fact. And,
Do you do the shots or the pellets?
I do the shots now, and I've been looking at how I can get switched over to the pellets.
I started with the shots.
Insurance issues.
Oh, yeah.
I'm doing the pellets.
That stinks. It is.
Well, my insurance says yes, but it's been going back and forth. Dr. Bainen's awesome.
Okay.
Yeah.
Your staff out
Because
there.
I've been messing with it.
Thank you. Are you ready?
Yep, we got about maybe 11 more minutes.
Cool.
We'll be wrapped up. Here we go.
All the makeup on.
Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. Check us out. I'm here with Mike, and we were just talking a little bit about just, I think that what's happened with all these commercials between like the Nugenics and Axeron and all these different things, that at least guys that know, the majority of guys over, say, 45 have low testosterone, we'll say. But a lot of guys younger do that. You can't really use age to judge it. So they know, and people know the symptoms of it, lacking energy, low sex drive, aches and pains, changing your sleep habits. And another big one I see a lot is depression. There's a lot of guys that come to the office that have been diagnosed with depression. They're actually on antidepressants, and we'll do the hormones, and the hormones are just a mess. And we'll get them on, we'll use bioidenticals and get their hormones balanced out, and they're no longer depressed. So I think depression is something that's often misdiagnosed. You go to your doctor, and what people have to realize, a primary care physician, they're not set up to manage someone's hormones because there's a high level of supervision. You got to do blood works, you got to know what you're doing, you have to have other training on it. So if you're going to your doctor and they just throw a bottle of Axeron or Testim at you, like that's not managing your hormones, and it's really unsafe. So whether you go to Buckeye or go somewhere else that specializes in it, you want to go to someone who has some higher level of training, diplomate level training, and they're really going to watch your case because there's no cookie cutter system on this. Everyone's on different dosages, and you got to watch the testosterone, you got to watch the estrogen levels, look at growth hormone levels, vitamin D. These are all things that are essential for this hormonal system to work. So you got to go to someone who really knows what they're doing. And I think what a lot of people do is they know the symptoms now. So instead of going to the doctor, they run to the nutrition store and they buy these over-the-counter things that don't work. There's nothing over-the-counter you can buy to raise your testosterone levels. Nothing. It's impossible. We have over 1,000 patients at Buckeye. People have come in on all different types of stuff. I've never seen anything affect blood work. So I know there's nothing out there that works. So the only thing that works is if you're deficient is to take a bioidentical and simply restore your levels to what they're supposed to be. And there's no side effects to it because it's impossible to have a side effect of taking something that's natural to the body. So being afraid of side effects, there is no side effects other than feeling better and having like S and pace and higher sex drive and all that different type of stuff.
Seems like it would be more dangerous because you're buying. If you walk into your local GNC store, there's a whole wall dedicated to testosterone supplements. Well, if it's only natural. If I'm not feeling it from this, let's take more. Let's take more. Well, I'm sure those people are not having the blood test and seeing really what they're truly doing. So I see more danger than good on without having it professionally done and diagnosed.
Yeah, and anytime you're messing with hormones, you want to have blood works done and check what you're going on. 100%. You got to do blood works, and your body changes over time. So your dosage today might be different 6 months from now. That's why you got to do it every 20 weeks. You got to watch that blood work. And I'm not knocking on nutrition stores. Like we have the guys from Subzilla here all the time. We all need supplements. A good protein supplement, a good multivitamin. These guys have tons of great products. It's just the hormone replacement stuff. they're just not really effective, So I'm not knocking on nutrition stores. You need good proteins or energy boosters and stuff. They have some amazing stuff there. I went to Subzilla the other day.
It's a great place.
They had some. You been there? Like they have the best tasting protein. If you haven't been there, you got to check out Subzilla, guys. But I got the Butterfinger, it was like chocolate Butterfinger. Is that what it is? It was so good. But anyways, they have good stuff. But you got hormone issues. You got to get your blood work done. So what difference did you notice? So you got on. So you're doing injectables with us?
Injectables.
Okay.
Correct.
Yeah, and the one thing I'll tell you with our injectables at Buckeye that's different is you don't have to come to our office every week and get a shot. So
very convenient.
Yeah, we ship them to your house. We show you how to do the injections. I don't know. Does your wife give you a shot, or you give yourself a shot?
My wife.
Your wife does. Okay, cool. Yeah, my wife does.
Yeah.
Too, so. But we teach your wife how to give you the shot, and you get a shot once a week. But it saves you the hassle. I know there's some place you have to go to the office once a week and get a shot. That waiting room's got to be packed up on Fridays. Can you imagine?
No.
Drop your pants.
Nothing I want to hear.
Yeah. So, but there's no line. I mean, basically, you get it shipped to your house. We teach you how to either give yourself a shot or have someone else at your house give you a shot. And how long does it take to do it? I mean, it doesn't even hurt.
No.
It takes like a minute.
Yeah, if that.
Yeah. And the other thing that we do is we also try to boost your own testosterone levels. So if you're taking testosterone, whether no matter what form you're taking, you also want to take HCG with it.
Correct.
Which is
Big
human,
difference.
human chorionic gonadotropin. Because what happens, testosterone does work on a negative feedback. So if you're taking testosterone and you don't take HCG with it, your body will quit producing testosterone, and we don't want that. So we kind of hit it from both angles. So the HCG we give you increases your own testosterone production, plus we give you extra if you need it. And that two-sided approach makes a huge difference. I mean, do you notice a difference with the HCG?
It's a perfect combination. I can actually tell, even if I'm still getting the testosterone treatment, if I'm not doing the HCG, I can tell the difference. They work hand in hand.
Yeah, 100%. And that's the proper way to do it. So you're doing the HCG, you're doing testosterone, and we also watch your estrogen levels because certain males, testosterone converts to estrogen, and the estrogen can be dangerous if it goes higher. So we watch that, and we usually we use a Arimidex, we mix it with the testosterone. Mm-hmm. But once again, that's kind of like that custom compounding we do because everyone's dosage is going to be different. So your dosage will be different than my dosage will be different than anyone else's. So and that's something we really monitor closely. So all right, so the people are listening to the show here. We probably have their interest a little bit. How was the process? Like, you come to the office, the first visit, was it like...
Kudos to your team in Grove City. That's the only one I've been to. Everybody is, you can tell, they're true professionals. From the get-go, I felt very welcome. I was really skeptical, a little nervous.
How'd you end up there in the first place?
Recommended. I was at the gym, happened to be talking to a guy there, and it was a friend of a friend that knew you very well, and said, you need to go and talk to these people. And at that point in time, it was just a consultation. And we went in, and I started from there, and I met your staff, and felt very comfortable, and here I am.
So you did blood work pretty easy, and insurance usually covers your blood work, right? Did blood work, and it usually takes 5 to 7 days to come back. We bring you back, we sit down, we discuss what if there's issues or not. And if you decide to move forward with the program, basically a week later you get stuff to your house, you bring it into the office, we show you how to do it, and that's pretty much it.
Correct. We were talking about the family practitioner stuff, and they don't test for the free testosterone. So the levels that they were reading was important, but not really based upon what really matters, what is affecting you. So, and that's the big thing that I got the difference from the blood work from you guys. So,
and one thing I'll tell you too that people don't realize, if you're on testosterone gel. Number one, I think it doesn't make a lot of sense for guys, but if you are a guy listening, if your doctor's not saliva testing you, because testosterone gel doesn't even show up in your blood work. So if you're on testosterone gel and your doctor's doing blood work, it's useless because it won't even get into your venous system. So kind of a way I tell people, if your doctor knows what they're doing and you're on a gel, if you're not getting saliva blood work done or urine tests done to test your levels, they're not even monitoring anything because that's the only way it's monitored. So as I said, we use testosterone gel on females, but we have to saliva test them because it doesn't show up in their blood work. A lot of people don't realize that. And the other crazy thing is there's lots of people that, I had a patient came in yesterday that they're on hormone replacement therapy somewhere else, and the doctor's not monitoring their estrogen levels. Like, you gotta watch your estrogen levels, your free testosterone levels. These are, estrogen and testosterone are your right and left hand. If you're not monitoring estrogen, it's really not safe to be doing hormones at all.
Right. What I have found is my doctor was so impressed with your guys' blood work. Instead of them doing my blood work, I get your results back and I take it to my family doctor and drop it off. So she gets it actually instead of once a year. It's more.
weeks.
Yeah, absolutely. So she can keep an eye on other things besides the testosterone.
That's awesome. That's awesome.
So it works out well.
All right. Well, I really appreciate you coming on here today,
Yeah,
and
thanks
taking
for
time out of
having
your
me.
day,
Yeah.
dealing with that traffic we had out there. Any final advice for someone? So if someone's listening, what would you say?
Don't miss out.
Don't miss out. I like
Don't
that.
miss
Don't
out. Absolutely.
And don't wait. I mean, sooner. I mean, I tell everyone this. Sooner or later, you have to decide in your life that you're either going to be fine getting older, or you want to try to fight the fight. Okay. And although you can't stop the biological or the chronological clock, right? You can stop that biological clock. So if you want to feel young, and people say, "Well, I don't feel that bad." What I would say is, how do you feel now compared to when you were late 20s, early 30s? Compare yourself to that. Because if you don't feel as good as you did in your late 20s, early 30s, you can feel that way again. Everybody can. It doesn't matter what your age, 60, 70, 80, anyone can feel that way again. Come in, get your blood work done. Check us out at BuckeyePMR.com. Until next time.